All right, hello folks, and welcome to Able Cafe. Today we are going to be talking about college and hygiene with our special guest, Dr. Chambers. Hello, Dr. Chambers.
Hello, thank you so much for having me. I'm super excited. This is my favorite topic ever.
I assume so. I assume so. Thank you so much again. Can you tell us just a little bit about yourself and the platform that you have created?
Absolutely. So my name is Dr. Shars Chambers. I'm a board certified OBGYN with fellowship training in pediatric and adolescent gynecology. And that's just a subspecialty that caters to women that are 21 and under, kind of focusing on the developmental years, the puberty and periods and all of those things, which is why I dubbed myself the period doctor, really creating a platform to one, just increase representation of a Black female doctor so that people can just see that. Because Marian Wright Edelman says, you cannot be what you cannot see. So it's important to actually have people to be able to see that I'm out here, learning this subspecialty and kind of putting that practice kind of in play. And then really just addressing generational misconceptions and educating menstruators across the board with an emphasis on Black and brown menstruators, understanding that we, can be the ones who really get the greatest brunt of the misconceptions and the greatest brunt of kind of heavy periods and painful periods without much explanation. And so I created that in July of 2019, just over a year ago, and it's just blown up bigger than I ever could have imagined. And I love it.
Absolutely. Yeah, you're doing your thing with this platform. It has caught quite a bit of interest, as you said, over this time span that you've
Yeah.
I mean, you flew in numbers now.
I'm just like, thank you, Lord.
Yes, absolutely. So let me ask you this. What sparked your interest to become an OBGYN?
I initially wasn't interested in OBGYN. My dad is an OBGYN, and my brother had kind of declared that he was going into obstetrics and gynecology as well. And so when I entered into medical school, I was like, I want to do something else. Like, we can't take care of men or children. Like, we need to expand our horizons, or so to speak. I did attend Spelman College, where, the emphasis on kind of being an advocate for women's health and for children was huge. Mm-hmm. And so I always kind of had that pull, that advocacy pull. And then when I got into medical school, I learned very quickly that I was a doer. Like, I didn't want to necessarily consult and just diagnose and then send it away for someone to do it. I wanted to diagnose it, fix it, and follow up, and have that kind of good relationship with your patient, but also an ability to intervene medically or surgically if necessary. So I knew I was drawn to surgery. And then when I got to OB, I was like, oh my gosh. I mean, with OBGYN, you're doing all of that. You're meeting people at fun times of their life, difficult times of their life. You're a great counselor, advocate, educator. You can fix things. You're a surgeon. You're all of the things that I wanted to be, and also a major advocate for women and children. And so that's how I ended up in obstetrics. And then as I delivered more and more people and had more patients, there was a theme. They kept saying, I wish I'd met you earlier in life. And I was like, interesting. Mm-hmm. Like, I wish they'd known this about their bodies before their second or third child. They'd known this about contraception before their first pregnancy, which made me say, I want to do something earlier. And that's kind of how I got to my subspecialty as well.
Nice. Okay. So you're able to do it all pretty much.
Yeah, I can.
Awesome. And that's what we're needing. So with all of that, once again, thank you so much for creating the platform, because it's such an overlooked, underappreciated topic. And the reason I say underappreciated is because we openly welcome female sexuality, but we sometimes dim the discussions on menses or the menstrual cycle. So we have those two that come into play, but sometimes it's hard to have those conversations. You have parents where it's hard to have the conversations. They do not have the conversations, or they just simply do not know how to have the conversations, right? Absolutely. So when we take all of that, because some of it is due to a lack of knowledge, but when we take all of that, how can parents handle these uncomfortable conversations about a menstrual cycle to their child?
Yes. So I always say the parent really has to deal with their own kind of reservations and insecurities and whatever they have within themselves about their own body, their own process of menstruation, whatever little skeletons they have in their closet, they really have to start dealing with those and normalizing it for themselves. Because your teen, your tween, they're going to pick up on you kind of when you're not being straightforward with it.
Right.
Another example, things that, well, I know parents can do it, because parents walk their kids through one of the strangest things in life without blinking an eye. When you're about 5 to 7, you literally lose all of your teeth. There's like empty space where teeth once were, and you just reassure your kid that they're going to get more teeth and that's okay. Like, that's terrifying. That's not a normal thing. It has a little bit of blood associated with it. It's kind of painful sometimes, and it looks kind of funny. Right. But if we normalize it, that child is reassured, yeah, I'm not going to be without teeth for the rest of my life. The fact that they're falling out doesn't mean all of my bones will break. We can, there's things that we have normalized as normal processes. And when you don't make them, one, hypersexualize them or make them super out of the ordinary or seem too uncomfortable, your kid feels more comfortable too. And so really don't fake the funk. Learn more about it, educate yourself, and then you can guide your child through it a lot better than maybe you were guided through it yourself.
That is interesting. So pretty much it's the parents' own insecurity that's pretty much preventing
so much more. And it's projected onto their child. I mean, significantly. It's projected when they say, you're too early to develop breasts. No, I'm good and darn well that they're the perfect age of puberty. It's just that you're not ready. Right. And then in that situation, the child says, well, what's wrong with me developing breasts right now? And then it's hypersexualized. Like, well, you're supposed to be my baby. And they're like, am I no longer a kid? And then you have the adultification of Black girls. There's a lot of perpetuation of those things by the way we respond.
Right. Absolutely. Absolutely. Excellent word, projection, because that's it. That's the key right there. So when we take that and you have a parent that's asking, okay, my child is now developing early. When would you say their teen should first visit the OBGYN and OBGYN?
So the recommendation from ACOG, which is the American College of Obstetricians and Gynecologists, is between the ages of 13 and 15. And the idea is the average age of onset of menstruation is about 12 and a half. And so after you've started your period, you should interact with a physician, an OBGYN preferably, to understand if your period is normal, if it's abnormal, early signs of pain, and then get some guidance on how to navigate your periods, healthy hygiene, and what to look for so that we know that there might be a disorder. Having said that, it's normal for some girls to start their periods as early as 9, which some people are like, oh my God, that's like 3rd grade, but it falls within the realm of normal. Anything from the age of 9 to 15 is considered normal. And so there's no reason that 9-year-old needs to wait until they're 13, wait 4 years of periods to see a gynecologist. And so in that scenario, they can be seen sooner. For me, I see them as early as day of life 1 if you need me. Not that it would be a period issue. There's a number of things that can occur well before the age of 13 to 15.
Wow, okay. Very good. So with that, how would a hygiene discussion look? And when I say hygiene, this conversation of what an actual period is, how would that look?
So I like to use kind of support aids, depending on what the patient's understanding is. I really start with the basics. Just like, okay, on your bottom, you have, 3 holes where you pee from, where period comes from, and where you poop from. Okay, those are the 3 holes: urethra, vagina, anus. Above the vagina, we have cervix and a uterus. The uterus is the muscle where a baby lives and is grown, during pregnancy. The body allows that muscle to kind of fluffen up and kind of create an environment that's ready for a pregnancy. And when you don't get pregnant, it all has to come out. That comes out in the form of tissue and blood. And it happens almost monthly. And it's your body's preparation for pregnancy, and then say, oh, it didn't happen. And then it prepares again and says, oh, it didn't happen. And that happens over and over again until pregnancy occurs. And that's what a period is. It's your body's ability to carry a pregnancy, and your body starts to prepare for that around the age of 12. That's kind of how I summarize it for a younger patient. Okay. And then that gets into the hygiene part. Well, what you gonna do with that blood? You gotta either absorb it, hold it, or completely get rid of it, and then you can go into the menstrual products, the ones like menstrual cups and menstrual discs that just hold the blood until you can kind of discard it. The ones that absorb it, a tampon absorbs it inside, a pad absorbs it on the outside. It's really not, when you kind of simplify it in that fashion, people are like, oh, I get it. So
Yeah.
it's just your body's preparation and then saying, oh, it didn't happen. And then you having to manage what's coming out. And that's it. It really is. And if you want to get into all the causes of it, sure, we can get into the hormones and all those fun things that we blame for everything.
Mm-hmm.
But then you can kind of guide it from there. They start to ask questions once they understand that basis.
Right. And I think that's very good. I ended up having to have this conversation. I've had it. But I love science and I'm a visual learner. I like what you said, though, when you said that it's your body's way of saying, okay, let's get rid of this so that we can start fresh, you know, the next month. I didn't think about that, but I'm sitting here, I'm using Cheeto Puffs. I'm using Cheeto Puffs and Twizzlers to just build everything, you know, say,
It works.
This is it. But yeah, parents do sometimes have that hard time discussing that and saying, okay, how do I put this into words for my kid who's either, like you said, 8, 9, 10, or whatever age they may be, meeting them at that level and saying, hey, this is what it is, with them actually understanding it.
Exactly.
So, so with that, we also have the topic of sexual health. So when the period comes, so there's also the portion that parents have to talk to their kids about when it comes to the sexual health. That's also an iffy subject. I did a small poll or just a little bit of research, you know, with my friends on my Facebook page and asked them, you know, hey, would you have these discussions? Did you have the talk and things of that nature about your cycle? And surprisingly, quite a bit said no. And then you had some who are also uncomfortable having these conversations as well.
Right.
But then you have the menstrual cycle, that's an uncomfortable conversation. Then you have sexual health, because it's like, if I talk about sexual health, am I encouraging my child to actually go out and have sex? So I wanted to get your opinion on that, combined with birth control.
Absolutely. So sexual health is super important. And I think it still starts with the basics, right? It still starts with understanding your anatomy and understanding what that anatomy means. Mm-hmm. And so the same way that, you know, you have your shoulder muscles, right? That's used to lift things. But if someone gives you a massage, that can feel good. There's a normalization of pleasure and understanding when there's good pleasure and bad pleasure, good touch and bad touch. And those are the things that can be taught very early on in a child's life. And so as sexuality kind of comes into the picture, it can be kind of painted as a picture as adults have a good touch of this thing. For you in this scenario, this is bad touch. Because if you don't touch on these topics, not to use that word again, but your child is not going to be able to recognize sexual assault. You know, someone potentially abusing them in a situation. You want that to be very clear. And skirting around that is not going to do them any favors. Additionally, research has shown that discussing sex early on does not increase sexual activity. Those are actually the ones who are less likely to be teen mothers. The people that actually gets abstinence only teaching or no discussion whatsoever about sexuality are much higher at being teen moms, because they aren't understanding the processes behind it. And so the idea that I like to convey to parents is, you are not raising a child, you're raising a future adult. And what that means is your goal is to get them to be able to function in life appropriately. That means that you are teaching them how to make choices. So restricting them from understanding an entire sector of their body that they're walking around in every single day is only doing them a disservice. It's only doing them a disservice. Wow. So that child is going to have to navigate life without you at some point, be it in college, at an off-campus institution, whatever. And it's going to mean that everything you give them has to guide them on making choices. By completely eliminating this discussion, you are removing their ability to make an informed choice.
Wow.
Okay. And so values and religion and those things help us guide our choices. And that's what we instill into our children. But science is what it is. Bodies are what they are. Just the same way I wouldn't teach my child to drive and never talk about a car accident. Why? Why would you do that? Car accidents happen. They happen if you're distracted, happen if they're distracted. Now, it's not that you are the only person that can cause a car accident. Right. Someone else could bring it towards you. You need to be teaching them to defend themselves against that. That's how you teach someone to drive, because it's important. There's no protective measure never telling your kid that a car accident can happen, ever.
Right.
And then that segues into birth control. Just because you tell your kid to put on their seatbelt doesn't mean, all right, now I'm gonna drive crazy because I have a seatbelt on, right? Why would they do that? Or you put car insurance in the car. It's like, oh, my mama has car insurance, I'm gonna run to that mailbox. No, that's not even how teenagers think.
Right.
They actually don't make choices based on the safety of the scenario. They tend to be very impulsive. So giving them birth control does not increase sexual activity. It certainly doesn't increase teens' pregnancy rates at all. And so that's just something that we tell ourselves to comfort ourselves because we're so uncomfortable having the conversation, but it's not even logical. It's not logical at all.
Yeah.
So those are the ways I correlate it.
Yeah. I mean, that's a great analogy. I mean, I never thought about it like that. I mean, no, you do not put your seatbelt on and say, oh, let me drive crazy.
Right. We put it on because we know it's safer.
Right. Wow.
Yeah.
I might have to, that's a quote. I have to make that a quote of it. That's good right there. That's better insight than I've even thought about. So wow. Okay. That blew my mind. So as we've gathered that information, so we talked about, the younger generation. Let's go ahead and dive into college. So as you know, when we go to college is a multiple or a multifaceted place. Okay. You begin to find out who you are, whether it be sexual preference or just who you are, period. If you're a mixed race child, you understand, where you fall. Also, some use it as a party time, whatever. But the main purpose, of course, is to get your education. But when we take all of that, let's talk about the parents first. So with the parents, what tips and strategies and tools can you give them as they begin to, I guess, how can I say that? As they begin to help their child understand their body before going to college and while they're in college.
Absolutely. So when it comes to college, a few things enter into the picture that weren't there previously. Oftentimes it's going to be, one, an exposure to people who are from a variety of walks of life, right? People who don't know who you are. And so you can establish who you are from a sexual standpoint very early on. And that's not to suggest that reputation is highly important, but as you establish yourself in a social circle, sexually and socially, that's important. And so it's kind of that understanding that how you're presenting yourself to your peers is the way they're going to interpret you. You're introducing yourself to an entirely new place and a new group of people. And so you have a lot of power there. And so you want to wield that power appropriately. And so what that looks like is understanding your environment, understanding that things aren't fair in the sense of girls are judged by their attire, by what they say, how they dance, how they walk, how they talk. None of that is remotely a victim blaming type thing. It doesn't welcome sexual assault, sexual aggression, but in an environment like that where alcohol and drugs can be involved in party scenarios, you're going to see that a lot more than possibly it was in high school. So the ability to navigate situations where there's unwanted sexual advances is important. Able to understand consent. And what I like to really convey to young girls about consent is it's saying no, but also understanding that no is valid. It's valid even if you left the party with them. It's valid even if they walked you to your door. It's valid even if they walked you to your door and sat you on the couch. It's valid if they walked you to your door, sat you on the couch, and took off your shirt. It never loses. You never lose the ability to say no. It doesn't matter. There's no point of no return. You always have that autonomy over your body. And so I think that's important to let girls know because you are in these uncharted territories, right? Your parents didn't let you have boys in the house. You've never been on the couch with a boy, or something like that. And so talking through scenarios, I believe, is super, super important. Guiding your child, when you put that cup down, if you're drinking something, it's no longer your cup. It's gone. Because you have to watch that with your life. They're predators. And so I think what parents need to do, it's not to scare your child, but there was a documentary, the name escapes me, but it was talking about the prevalence of sexual assault in college. It is at such a high rate because people are entering into this space and they have not been guided. They've not been guided through this, and they just don't have the chaperoning ability of their parents around. And so being smart, teaching our daughters and sons, please listen, and sons, how to treat each other, how to establish their consent, and how to respect another person's consent, I think is one of the more important things you can do. In addition to that, if your teenager wants birth control, help them get some birth control. Because you saying, I don't want you to have sex is not a form of contraception. Shame is not a form of contraception. It never has been. And so if your child is honest enough to say, I want something, to protect me, I am thinking about it, or I have had sex, and I would love this before I go to college, I think that can be one of the best things that you can do for your child, supporting them and getting them some birth control as they enter into this uncharted territory.
Excellent. And that is highly important. I'm glad you also said, and teaching the boys.
Oh, absolutely.
Sometimes that word no, it falls solely, for whatever reason, falls solely on the young lady, and it gives them an excuse. Guys, it gives them an excuse. It takes that off of them for whatever reason.
Which is the most mind-boggling thing, that we could ever allow that to be perpetuated. The guys are so carnal in nature, and their bodies make choices, but they're the executives in all of the C-suites, and they're the leaders of the free world and the greatest senators. It's like, are we gonna make this make sense, or are we gonna hold them accountable? And a big deal is holding your son, your partner, your husband, whatever man in your life accountable for the choices they make, and letting them know that this is the boundary. And I expect that of you. There ain't no boys will be boys. There's rapists will be rapists, and we will acknowledge you as that, but we're not letting this slide. And guys have sexual pressures as well. They need to be able to say no to more aggressive women, to more aggressive partners of any gender or any sex. And so it really is a two-way street, but I really want desperately to empower women and also empower men to rise above the excuse of boys will be boys, and that women are able to kind of speak out against sexual advances.
Right. Great. Oof. Come on, you talking tonight. Come on here.
Listen,
right.
These topics I get fired up about, clearly.
I see. Look, I'm right along with you. Because it's needed. It's things that's needed, as said. So when we look at, so we've talked about understanding their bodies. When we look at proper hygiene.
Yes.
What does proper hygiene look like in college? They start getting boyfriends or partners or whatever. What is that proper hygiene?
So proper hygiene, it really should start when you're quite young, because the anatomy of your body hasn't changed drastically. So it's as simple as that, wiping front to back. We always say that, making sure they're showering regularly, making sure we're not applying hyper-scented or super strong lotions and soaps and body washes to the vagina. That's completely unnecessary. You need an unscented mild soap, and that can literally just kind of drip from a washcloth above downward, and then you can pat dry. There's no aggressive cleaning necessary really for the vulva and the vagina. The vagina is self-cleaning. There's no need for douches and all that fun stuff. Leave it alone, save your money. Those are the basic things. As it relates to menstrual hygiene, that's where we emphasize a lot more, because that's a big deal, kind of managing bleeding and menstrual products. So that's making sure that we're not sleeping in tampons, not wearing tampons longer than 6 to 8 hours, changing your menstrual products appropriately. We typically say change a pad every 4 to 6 hours, just because menstrual blood is blood and it's going to smell. It has a certain smell. It's not abnormal, but over time, it's going to cause some sort of smell. So those are really the basics, and they just continue throughout college, understanding that, when I was in college, I was at Spelman, we didn't have no air. we had to have our little pretend fans in the windows, so you're hotter. You're just like, and so hygiene is a big deal. You're showering in like these communal showers, so wearing shower shoes, all of those, but it's specific to your college setting environment. And so, looking at your college setting, understanding what you're going to deal with and mounting your best defense against that is really the best thing to do. But we're the douching, the vaginal steaming rinses, all those things that people are really selling. There's no need for that to increase in college, and it's not medically based. So I would leave that out from a hygiene standpoint.
Okay. So you said it's not medically based, and these are things that are not needed. Interesting point where you said that the vagina it cleans itself.
Yes.
Pretty much a self-cleaning oven. Can you kind of expound a little bit on that? Because sometimes, it's like, what? I don't what?
People don't fully understand that. So the vagina itself, and we're talking about the vagina, this isn't the outside, this is the inside. Okay. So the inside, the inner canal is the vagina. The vagina actually has specific types of bacteria that keep it acidic. That acidic environment actually keeps it clean and it balances itself. The pH is about 3.5 to 4.5 normally.
Okay.
And so it is when that pH is kind of disturbed when we have things like bacterial vaginosis. We can have like a yeast infection. Those sorts of things occur typically when there's something that is inhibiting the integrity of that acidic environment. That's why we don't want you introducing unnecessary things. Who cares if it says it's pH balance? A pH balance kind of wash doesn't mean that it's going to impact or interact with your vaginal environment appropriately. Mm-hmm. And even those pH balance washes aren't things that we recommend as medical physicians. Now, the kind of women's hygiene, feminine hygiene market is a $1 billion market. They will never stop making these products until people stop buying them. So the fact that the products just keep coming out just means that women have been taught to be so insecure about our bodies. We've been taught that our vagina should smell like a flower when nothing on your body needs to smell like a freaking flower. That we throw this money towards that. And it doesn't help you. It doesn't clean you. It creates a lot of problems. So.
That's knowledge there, because sometimes, and as you said, we've been built and taught to think, okay, it should smell this way. Like you said, like a rose. And that's just kind of not what happens.
It's not real. It's not realistic.
Right. So with that being said, what signs and symptoms should one look out for, like as their body begins to change? Are there signs and symptoms? If so, what would that look like?
So normal signs and symptoms of like puberty changes are going to be the typical puberty changes are you're going to have more acne, you're going to have breast development, you're going to have development of hair, and then there's odor that's going to increase. And that's just normal changes, after like 8 or so up to around 16. Those are the normal changes. Changes that are abnormal as it relates to hygiene are going to be things like increased amount of discharge. You should have a discharge. Discharge is normal. It comes from the cervix. It just means you have estrogen present and your hormones are functioning. Like discharge is okay. If the discharge is increased in amount, if it has a bad odor, if it's associated with itching or burning or some amount of discomfort, that is when we say that, okay, maybe this could be abnormal. Any rashes or lesions, those sorts of things, those can be abnormal. But the presence of discharge alone is not abnormal. And the presence of discharge actually precedes the first period. And so I have patients coming in, they're like 11, she's got discharge, something's wrong. I'm like, oh, she's just going through puberty. Because as estrogen enters into your body, as that first kind of breast bud occurs, your body starts to respond with the increased production of estrogen and increased production of discharge. So discharge is normal. It's the discharge that causes itching or burning, discomfort, has an odor. Those are the discharge kind of things that are abnormal you should look for.
Okay, good deal. So I know we spoke about the parents. I'm going to get into quite a few questions because we have quite a few questions that came in. We spoke about the parents. We spoke about body changes. As far as you personally, and let's say for the students who are watching and want to become an OBGYN, right? Or a doctor, period, right? What training, or is there training that you had to go through, and what was your process?
Certainly. So I figured that I wanted to be a doctor really in college. I wasn't one of those people in high school. It's like, I definitely want to be a doctor. I wasn't that sure then. So once I got to college, I actually just modeled my brother. He was 4 years ahead of me, which was perfect because he was just gotten into medical school. So I was like, what did you do? So after my first year, I did a program at Yale called SMDEP, which was a summer medical, I think it was a summer minority, like medical and dental program, education program. And there were these programs at all institutions, like across the universe. I mean, across the nation rather, at different universities and things. I just happened to go to the one at Yale for 6 weeks. It was lovely. It had some personal statement writing, some MCAT prep, and that was great. After my second year at Spelman, I went to Yale again for their more kind of exclusive research program where I did some breast cancer research. It was interesting lab-based research that I didn't have exposure to in undergrad where I was, and so it was good to get that. After my third year, I completely took off that summer to study for the MCAT by doing a review course. I did a Princeton Review MCAT course, took the MCAT and scored well, and then I started interviewing for schools. One of the biggest and best things that I did was actually have, at Spelman, different schools would come like visit and do mock interviews, and Duke, actually, their School of Medicine came and did a mock interview. Deborah Armstrong, who was their Dean of Diversity and Admissions or so, she did one. It was the best mock interview I'd ever done, but it helped me immensely because interviewing is a big part of your medical training and process. So after that, I got into medical school. I ended up going to my state institution, which was UAB, great school, went to residency, OBGYN residency after medical school. So medical school is 4 years, OBGYN residency for 4 years in Greenville, South Carolina. While I was in residency, I said, I want to do a fellowship in pediatric and adolescent gynecology. I applied to fellowship and went to Baylor College of Medicine in Houston for 2 years of training there. I just completed training in June of this year, and I'm finally a big girl. But I've been learning and delivering, and I've been a doctor for 6 years now, but finally on the attending side of things, past training. So it was a lot of training, but that was partly because I wanted to be a subspecialist. I knew I wanted to focus on a specific area. So that was my personal journey, and when I really started proactively kind of seeking the field of medicine, the things I did to stand out.
Okay, great deal. So with that process, what can you tell students as they, prepare? You have some who want to know what they want to do in high school. Sometimes that changes once they get to college.
Of course.
But for those who want to become a doctor, how would you tell them to press forward to make sure that you are in line and that they have everything together?
Yeah, certainly. So I think first you have to identify your why. Like, why do you want to do this? What is the problem, the area, the person, the patient that you want to be that physician for that can change the trajectory of their path? What are you identifying and what are you bringing to the field? Because once you identify your why, the how matters a lot less. Because there's always going to be some changes in your road. There's going to be something that you don't anticipate. I knew that as it related to Black women and getting into medicine, specifically Spelman women, a lot of our issues were related to the standardized testing. And so I knew that the amount of focus and effort I put on that had to be significant because I didn't want that to be my only barrier. And so really identifying your why and being as strategic as possible to getting to your end result. That process by which you get there may change, but if you still have that why, you will cling to it. And if there was a post recently that kind of was very popular on Instagram. It's a bunch of Black doctors talking about all of their points of adversity, every test they failed, every family member they lost in training, every chronic illness they've been diagnosed with, all of these things that people had said to them along the way. People will underestimate you. People will want you to fail, but way more people are literally depending on you to succeed. And it's one of those things that takes a lot of cognitive labor. It takes a lot of self-reflection and knowing deeply who you are and what you bring to the table and that you deserve to be at that table. And one of the things Michelle Obama said was when she started to get into these rooms, these really exclusive rooms, she realized these folks aren't really that smart anyway. Like she belonged. You belong. You just have to get there. And it's a long path. So that's why that why is so critically important, to recognize it, cling to it, and revisit it over and over again. Because this was a 10-year process for me. That was a very long time. And so because I kept thinking about, I think, the end result and had loving and supportive family, close relationship with God, all of those things that keep you grounded, that's how you get through. But no path is the same. Don't do what I did. It may not suit you. No path is the same, but you have to listen to that inner voice that said, this is my calling. Because I believe it's my calling. There's not a person in the world that can tell me I'm not supposed to be doing this. You just can't. And that's how you persist.
Absolutely. When it's a passion, it's not a job.
Exactly.
It is not a job. I know one thing, my mom had me do quite a bit of internships. And I had a school where it was a magnet school. So Fridays, my internship was at the hospitals. Okay. So I wanted to do pediatrics. And so she made sure that I did all of the internships or whatnot. They also call that the weeding out process. That's where you find out if your stomach is able to handle, putting in a C-line. I was putting in a C-line and my partner just straight fainted. And I was like, okay. And it was on a baby. And so you find out then, a lot of hands-on training. I think that's good for students as well.
Oh, great.
Hands-on training.
And it's limited now. It's limited now because of COVID. And I think that's hard for a lot of young people that are pre-med. They're like, how can I get my training? How do I get my shadowing in? Institutions know that. They know that we're limiting parties, in the hospital and such. So being creative, getting involved where you can. There's some virtual programs looking out for that. But that's a global understanding, and they're going to understand that as you move forward.
Yes, absolutely. Absolutely. As far as the high school student that is getting ready to graduate and go to college, what advice could you give them? Just even if they're not planning on going to school to be a doctor, what advice would you give them as
honestly, that freshman year, understand that it's very difficult to bring up that good GPA. So if you could start off strong, start off strong, figure out how you study, figure out, where you study best, get that place on campus. Like I study best in the science center. I was in that science center study room, and that's where I lived. Because I knew I needed to be there, because if I was at home, I was going to take a nap. Understanding how you study and learning yourself earlier and getting that under control earlier sets you up for success. Because this is a completely different ballgame. This isn't high school for a reason. And as you navigate your learning style, do you need to sit in the front? You need to sit in the back. Do you need to attend class? You need to actually read the transcripts. Do you need to write in different colors and take notes feverishly? Or do you just need to pay attention and just learn and then kind of digest it later? I learned those things about myself pretty early on. And even at some point, I had taken notes for like a biochemistry class. I actually took this at Morehouse. I was the only girl in the class, and the professor was this older, obviously very sexist man who told me on the first day, no girl has ever passed my class. I was like, well, I haven't taken your class, but I took notes. I took notes, and I could tell that something was going to be on the test by the way he changed his inflection, like his tone. He would just say it at the end and try to slide it in. I'm like, that's going to be the bonus. And I would highlight and circle it, And I did very well in that class. People were like, how did you know? I didn't even hear him say that. So learning your teachers, learning how you study and kind of measuring that success and getting yourself in sync. Then go out and party and start to balance that. Now, it's easier said than done. This might be your first time having freedom. You might just lose it. Like, I party on Mondays. But my advice would be that there's time for that. College is, 4 years. It's a beautiful time. It should not be squandered. It's the best time of your life, in my opinion. But it's better done with a decent GPA so that you can live the life you need to after college and not have to, make up for it at a later time. GPAs can be overcome, but it's just difficult. And you want to set yourself up for success and not failure.
Absolutely. Absolutely. Watching the teacher and their behaviors is key.
If you'll learn. Yeah.
If you're able to tune into, behaviors and what that looks like, do it.
Yeah.
So lastly, the student who is not planning on going to college, because college is not for everyone.
No.
So the student who does not plan on going to college, what advice would you give them as they prepare for adulthood?
Oh, certainly. I mean, adulthood has everything to do with maximizing opportunity and making choices in the short term that will affect you in the long term. And the better you understand how your day-to-day choices affect you in the future, the better you will be at adulting. Because either you can make choices early on, and this is just a theme of life. You make choices early on that may look different from your peers, that may restrict you a little bit financially, whatever, so that you can have greater opportunity moving forward. The opportunity that I have today as it relates to opportunities for making money, opportunities for networking, are so broad. But that was because of a very long time period of restriction. I mean, when I was in training, there were so many events that I missed. There were so many family gatherings. There was so much that I couldn't do because you don't get paid a lot In residency and fellowship, you don't get paid a lot, you know, kind of that delayed gratification sort of thing. And so while I don't want you to have delayed gratification, understand that so many things can be an investment. And so looking to your future and not making these short-term decisions just in that moment and understanding you're affecting that future self. I always think about Shars in 10 years. I'm like, Shars in 10 years is about to be really mad at me for what I'm doing today, you know?
Right.
It doesn't mean you restrict yourself and withhold good things from yourself, but you just do things with purpose. Do things with purpose, and you do things with purpose because you believe that you deserve to have a better life tomorrow. And it's not that you're keeping anything from yourself today. It's just that you believe that better is possible and better can happen, and you have control to some degree about that better. And I think once you choose that and you own that, that's really when you become adulting, because you're making choices thinking of, not just of yourself in this moment, but other things. And then, I mean, of course, you get a family, you get children, you get all those things. You're making choices for them too, and that's when real adulting begins. And I'll tell you about that when I get there, because I'm not there. But that's the advice I would have.
Yeah. Okay. Thank you for that advice there. You know, a lot of times in college, you think you're grown then. And then once you graduate, that first bill hit.
Oh, those bills. And they just keep coming.
Don't stop. They don't stop at all.
And that's when you start to appreciate your parents.
Right.
Or paying fees.
Right. I had to say, I was like, man, I thought I was grown. This rent payment,
that will get you.
it was something else. Okay. Something else. So we have some questions lined up for you. Are you ready for that?
I am ready. Let's go. I'm excited.
All right. So I know you mentioned this a little bit earlier, but I'm going to ask it. It's this person asks, they says, should I use pad, tampon, or a menstrual cup?
It's totally your decision. I know that's like such a lame thing to say. I have a menstrual cup. Let me see if I have one here.
Yes.
Well, I have a menstrual cup nearby because I work with Flex.
Okay.
So I do see that. But anyway, so it really just depends. I just don't want people to think that there's only tampons and pads. Like, yeah, in the 80s, maybe. Like, even in the 80s, they had menstrual cups. But people need to understand that just because your mama used this and your mama's mama used this doesn't mean it's going to be perfect for you.
Right.
So, a tampon is perfectly fine. It just absorbs internally. A pad absorbs externally. A menstrual cup kind of looks like this. It's flexible, and it has this kind of material that holds the blood. And so you can turn it and actually slide it in like this. It can be super, like this is smaller than a tampon. So it can easily be inserted, and it expands to fit the vaginal canal and just holds the blood. And so it just depends on what you want. This you can wear for 12 hours, which is more than a pad or tampon. They say you can have sex with it in because it's actually holding things above. It's like almost separating everything. So it depends. It depends on what you want. If you want to go swimming and you want greater protection, then yes, maybe a tampon or a flex disc is better. Obviously, a patch I can absorb anything in a pool of water. Like, that's not going to work. If you don't want to have something bulky in your underwear, then using a tampon or menstrual cup is going to be better. So it depends on what your needs are, what you're comfortable with. But there's nothing medically that's better about any of them.
Menstrual cup. So, because I don't know much about it. Okay, I don't know.
Yeah. And it's not this. It's actually shaped more like a tulip, a little bit more of a true cup. Its shape doesn't conform much except at the top, and it sits in the vagina kind of like that. This is just a little bit flatter. A disc is a little bit flatter, but it has the same premise.
So that's the disc. Okay. That's
the disc. The cup is similar, but it just has literally more like a teacup kind of shape.
Okay.
Yeah, interesting.
Yeah. All right. So this one says, my boyfriend makes PMS seem so bad, but it's not something that I can help. How can I tell him it is not a bad thing and to get over it in a nice way?
So it's not the PMS. I wouldn't say PMS is a good thing. It's just exceptionally common. It's still disturbing for a lot of women. So it's a constellation of symptoms that happen before and around your period pretty reliably. That can be irritability, bloating, kind of headaches, a number of things that affect you, and they affect your daily activities. And it can be pretty rough. I think that men need to understand that it is a direct result of the rise and fall of hormones. And, you may be doing your best, but maybe their understanding really just needs to be like, don't be triggering me during this time. Understand that, I'm not trying to be irritable, but also as women, we have to verbalize that. Say, I'm on my period or I'm PMSing. This is not a good time to talk about this, and lay down those boundaries and make it very clear. I do think it's important for partners, regardless of gender, to understand physiologic processes of each other. Like, that's just being a good partner. You need to understand what my body is going through and how to support me during it. And so, I think letting your partner know that PMS is real, these are the time periods in which it occurs, and this is not me trying to be rude to you. It's, something that I have to deal with. If you could support me through this, that could be, most helpful for our success as a partnership. But I do think that's important to have a partner that is willing to understand it and not, vilify you for something that's happening to you that you're trying to overcome, you're trying to actually kind of manage.
Gotcha. Okay. Good for a partnership. Communication is key. Is key. All right. So this next one says, at what age should I give my child birth control? And is that encouraging sex? I know we touched on that.
Right. We touched on it, that it's not encouraging sex. And what that means is, as a parent, you can encourage sex, but you could, your words could say it, but giving a child birth control does not change their decision-making process or the child that you raised. Either they're going to have sex or they're not. And the provision of birth control doesn't change that. There's no optimal age. The idea would be if they need birth control to control other things, because there's many benefits to birth control: cycle regulation, controlling endometriosis, decreasing just normal period pain, a number of things. Even for acne, we use birth control for that. So there's a number of reasons that someone might be on birth control that's not contraceptive specific. You should put them on contraception when they need contraception. When they are thinking about having sex or they're having high-risk sexual behaviors. I had a mom that wanted to put her kid on contraception because she kept kind of hanging out with boys or inviting them over when she was at work. The mom still needed to work. She didn't have adequate, childcare, especially with kids being home from school. And she was like, I think she needs to be on birth control. So if you think that their risk for getting pregnant is increasing or has increased or is just there, that's an appropriate time to consider contraception.
Okay, great way to put it. Great way to put it. Okay, and someone asks, what can I do about cramps besides over-the-counter meds? So I guess maybe like is there a natural remedy or?
So in some circles, magnesium can be helpful with like bloating and cramping. It's one of those supplements that has a ton of benefits. Taking a hot shower, exercising, getting adequate water, avoiding constipating and inflammatory foods can all be helpful. And then, of course, over-the-counter medication is one thing. We have prescription medication, which largely is like birth control, like hormonal medication that certainly improves cramping significantly. Combined oral contraceptive pills can improve cramping by 80%. So that's quite a bit. If you have terrible cramps, you don't need to have terrible cramps. We don't want you missing school because of your cramps. Right. If you're missing school because of your cramps, missing work, that's too much. That's not normal.
Absolutely. Okay, so when it's interfering with everyday life is when you should kind of be worried.
Okay. You should be worried because the normal cramps of periods should be manageable.
Yeah. Okay. How much blood should come out and when should I be worried?
So we say that when you're changing a menstrual product more than an hour and it's completely saturated for more than 2 hours, that's too much blood. And so that could be like a maxi pad that completely gets saturated. That could be your standard tampon that's completely saturated. You're like bleeding through it. And that's just within under an hour. And that's for more than 2 hours. That's when we say you need to look at something's not right. Also, passing really large clots. They say clots larger than a quarter really aren't normal. That suggests that you're bleeding rapidly. It's collecting inside and then it comes out. So the clotting kind of amount is also important.
Okay. So they need to look out for that as well. And what warning signs should I look for?
So certain warning signs are going to be often related to the bleeding and pain piece of thing. So pain that gets worse throughout your period or is present after your period ends is abnormal. It can be a sign for like endometriosis, adenomyosis, or something else going on. And then really bleeding that lasts longer than 8 days is abnormal. Bleeding that occurs in between your periods is abnormal. And then bleeding more often than every 21 days is abnormal. You shouldn't be having a period 1 week, off a week, period 1 week, off a week. You shouldn't have a period that lasts for 30 days.
Right.
Those are abnormal things that should be looked into, because when you lose too much blood, you can have anemia. You know, your body can only make red blood cells so quickly, so that really can be very significant.
Okay. All right. I play sports and prefer to shower afterwards in the locker rooms, but I have a hard time when I'm on my period. Is there an easier way or a better way to do this without being embarrassed?
Well, I mean, honestly, when you think about the methods of absorption and the way that you can manage your period, really, a menstrual cup, menstrual disc, or a tampon can allow you to continue to absorbing blood while showering, and then remove the product at the end of showering if you don't want to actually be like bleeding in the shower, which is fine. You know, that's fine. I personally think it's fine just to be bleeding in the shower. It's a shower. You know, knock yourself out. It's like the one time you can just take a break. Yeah. But if you're worried about the social kind of piece of it, if there's like communal showers, you don't want anyone to see like blood running down the drain. One, I would argue you're probably in a women's shower anyway, and they should get a life and grow up. But also, you can just wear one of the more absorptive methods, or the methods that hold the blood within, so that you don't have to deal with that.
I know that sometimes bring anxiety for
Yes.
you know, because it's like, goodness, I have to shower in front of these people. What if they see it? You know?
Right. Some people don't like pooping in public restrooms, right? I mean, they're just like, oh, somebody will hear this. It's a normal process. So I'm not saying that that's abnormal to feel that way and have that level of anxiety. We all do it, you know, but they could just chalk it up. Right. Or you can just wear a menstrual disc.
Yeah. Or that. But it's perfectly okay.
Yes,
you know,
okay.
It goes back to what you were talking about earlier, where we were talking about the shame of it. Sometimes it's that shame, and it's like, goodness, but it's something that's so common. I mean, it happens. I mean, if it happens, it happens.
It happens once a month for about 40 years of your life.
Right. Right. All right. So this one says, my daughter started her period at 8 years old as of 2 weeks ago. Should I bring her to the OBGYN? Why has this happened so early? Could this be a hormonal imbalance? She is still a baby.
Oh, so, okay. Pubertally, she is not still a baby. It is appropriate for an 8-year-old to be in puberty. It is not normal for an 8-year-old to have started her period. So that is earlier than the normal kind of range, which is 9 to 15. So yes, you can take that baby to a gynecologist, to someone, and talk to them. In some scenarios, it may be appropriate to even do menstrual suppression. We can give medication to stop the period for some amount of time until she has time to grow up into it, to be old enough to tolerate a period. Additionally, when your cycle starts too early and you haven't completed growing, that actually impairs your height. And so you can have girls that are 4'2" or something because they had precocious puberty, too early of an onset of the production of estrogen, because estrogen closes the growth plates. So we actually care greatly when puberty occurs too quickly and periods occur too quickly. In this scenario, stopping her period could be helpful. It wouldn't necessarily restore height if she's really, really short, because oftentimes when you start your period, you only grow like 2 to 3 inches more, or 2 to 3 centimeters more rather. So it warrants medical evaluation by an endocrinologist and a gynecologist.
Wow, I did not know that. One, I did not know that you can suppress for, a younger child. I did not know that. One, I didn't know they started.
And we do menstrual suppression for children who have disabilities, different needs, special needs, or developmental delay. Okay,
I just never knew that. What would that look like? So if you have an 8-year-old, I guess I'm just trying to visualize that you have an 8-year-old who has started her period what is that? That's what, third grade?
Mm-hmm.
How does that look? How does
So
that?
it's normal for a 9-year-old to start their period. 8 is too early. Even a 9-year-old is really early in the spectrum of age possibilities.
Mhm.
But if we wanted to stop it, there's certain hormones that you can use. You can use injectable hormones, pills by mouth, and it's not that you stop time, it's just you stop the actual kind of cycle of the period itself, and so it really could just be for a year or so until she's older and feels better about it, until she's not the only one in her class who has a period, something like that, until you can see a specialist and make sure that things are okay. But it does warrant medical evaluation.
Okay. That's something new. That blew my mind there. Okay. This next one, I'm very interested in your answer on that. So this one, and I prefaced this question. I said, should dads include the menstrual cycle talk? And here's why I asked that. It says, I'm a single father. Should I have this talk? What should I say in this talk? Because I don't know anything about this. I want to be involved, or should I just send her to my sister? Help with the awkwardness.
So I think dads should be included in this. And I actually did a series called Girl Dads for, single dads or dads that just wanted to be involved in the conversation. And I was like, we're not calling you out, we're calling you in to a space that we previously left you out of, saying this is women's talk, this is women's territory. But to that dad's point, yeah, there are dads out here who have their teenage daughters for the summer, and that same daughter's like, I need help. Or, their daughters who are going to start their periods when they're with their dads. It's a reality. And so what I kind of played off of is like the girl dad thing. Girl dads are ones that want their daughters to succeed just as much as any boy. They want them to have everything in life. Why would you not support your all-star athlete as much, in their periods as you do with everything else in their life? Be that supportive parent. They need you to be it. And they don't want to stop being your daughter and your child. And they don't want you to be have some aversion to a normal process that's happening to them. Right.
Yeah.
And so if you send me an email or a DM, I can send you the video that I did. I have it actually online for purchase, but I'll send it to you for free. It's like a 30-minute video where I talk to a group of dads about how to, talk to their daughters, what all dads really need to know about puberty and periods. And so I do believe that dads should be a part of the conversation. Not that they need to be dragged into something that they're uncomfortable with, but that's happening to their daughter. That daughter's having that period whether they like it or not. And so I think part of being a good parent is being able to help your child navigate important parts of life that they're going to need to navigate as an adult. And I don't think that needs to be drawn along the lines of gender.
Okay. I wondered, I was like, what would that conversation look like with the dad? Like, what would he say, to his daughter? Because sometimes it can cause embarrassment if the dad does not talk to them about it. They're walking around and they're like, it caused that type of embarrassment. But what could a dad possibly say?
Oh yeah, anything that a dad says, because there's so many things your kids go through that you don't go through, like your kid missing prom. Like ultimately, you can just say, "I know that this may be difficult. You might not feel sure about it. It might be painful. Understand, I'm here for you. I'm a person that's going to help support you through this." No one's asking the dad to be an expert on the topic, but you need to know something. And you don't need to freak out if they bleed. You need to take them to the ER. You have to know something. And that's the part of being a parent and getting your child to adulthood and being able to navigate life. But more importantly, being able to sit with them and be a listening ear so that they're not abandoned in their confusion and discomfort. Just because your daughter's at your house doesn't mean for the duration of that week that she's there, she has no one to talk to and she suffers through her cramps. She needs to be able to come to you and say, I have cramps. I need ibuprofen. I need pads. At least be able to have that conversation. It's not that you need to show them the anatomy of the female body and be like, this is what your hormones are doing. No, be a supportive parent that's willing to broach that topic so that you can help your child.
Absolutely. So pretty much just providing the comfort and validation.
Yes, comfort and validation. I acknowledge that this is happening. This is a normal process. I'm not going to freak out. What do you need from me? How can I support? That's it.
That's it right there. Those words, those are important.
And partners, you take that too. All boyfriends,
Yes, I
you
love
take
it.
that too.
I love it. Okay, so we have two more left. Let's see. My daughter has PCOS, so polycystic ovarian syndrome,
Yes,
uh,
yes.
and has extreme facial hair. How can we manage the facial issue without me seeming insensitive and a limit to bullying?
And that's hard, right? Because PCOS really causes some uncomfortable symptoms and signs. That
Mhm.
excessive facial hair can be a lot, and then excessive acne. And as a parent, it's not like something you want to point out to your teenager who's already like insecure and kind of dealing with that. Like, hey, I think you have too much acne. But seeing that, taking them to see their pediatrician, talking, and you can even send a note to the doctor privately. I have parents that pull me aside and say, hey, I'm concerned about the hair on her face. She hasn't said anything about it. I don't want to make a big deal about it, but it's one of my concerns. And as a physician, I can say, I've examined 700 teenage girls, and I know that based on this, I think you have more than what I typically see. Let me see if I can fix that. Is that something that you've also noticed? And I have that kind of training to enter into that conversation when maybe the parent doesn't have that kind of training and they're not ready to broach that. That's fine. As a medical professional, I should be able to bring it up and talk through it and then talk about the options. It's hard when you point out something you have no understanding of why it's there or no ability to fix it, right? But it's a little different for me. I can say, not only do I understand why it's there, it could be an actual diagnosis, and clearly they know the diagnosis, and we can fix it. Would you like it to be fixed? Would that help you? Is that something you care about? And some girls are like, I don't care.
Yeah.
Okay. If you don't care, let's talk about the other things about it that we should care about and see what makes you happiest, you know? And that goes across the board when it comes to weight. We don't want to be fat shaming. That's something that you never want to do. But there's reality that excessive weight and underweight, all of those have their associated side effects and risks. And as a medical professional, I have to talk about those. And so sometimes you really need to, and most of the time, I recommend that you team up with your medical provider so that you're providing the best care to your kid. You know, you don't have to do this alone. I don't want parents to do it alone. That's
Right.
why we're here. That's why physicians are here, to partner with you, be it your pediatrician, whatever specialty physician that you get referred to, they can help. But dermatologists, gynecologists, and endocrinologists are the people that really kind of really shine when it comes to PCOS.
Okay. And just to talk a little bit about PCOS, for those who do not know exactly what it is, can you touch on, kind of what it is?
Certainly. So PCOS is polycystic ovarian syndrome, and it's really a hormonal imbalance that the name is a little bit misleading. It's not that your ovaries have a ton of cysts on them, those bad cysts that cause you to have pain or need to be surgically removed. It's a bunch of follicles, and it happens because the rise and fall of the hormones is not happening reliably enough to allow for ovulation, which is release of an egg. So instead of that one follicle releasing that egg reliably, the follicles kind of get bigger, but they don't quite fully rupture to release an egg. And so you just see prominent follicles on the exterior of the ovaries. It also leads to abnormalities in the hormones that increase things called androgens, which are hormones that you typically see that are higher in males. They're still present in women, but lower in women. And they lead to those kind of male characteristics, which can even be male pattern baldness. It can be excessive hair on the face, kind of in the chin, the chest, the upper thighs, buttocks, and even lower back. And then there's abnormalities in the way your body actually interacts with sugars and insulin. And so that's a big deal too. There's increased obesity. About 80% of women with PCOS are obese or overweight, which means that 20% are not. And so there's also a lean PCOS picture. So people who are thin who still have PCOS. And PCOS is one of the leading causes or most common causes of infertility, because if you're not releasing an egg reliably, you're not able to get pregnant often. And so if you only have 3 periods a year, you have much fewer opportunities to get pregnant. And so when they get around the time of like 25, 30, and want to have a child, they certainly do struggle. And so you have to partner with your physician, and then there's other cardiovascular risks that go along with it too. So it's pretty complex. It's certainly serious, but it's manageable when, one, you understand it and you have a physician that can partner with you to kind of guide you through all of your options.
Okay, awesome. I knew someone who had PCOS, And so I knew just a little bit about the facial hair, and it's not something that's talked about,
Not enough.
yeah. If you don't know about it, you just simply do not know about it. And all you see is, okay, so this person has facial hair. Why is that? And you don't want to ask the person. That's not something that you just ask, but that is something that's just it's not a prominent conversation. So.
Exactly, which is wild because PCOS affects 1 in 10 women of reproductive age. 10% of people, that's exceptionally common.
Yeah.
So yeah, we need to talk about it more.
Yeah, absolutely. Absolutely. This last question, you touched on it earlier. They said, are there any benefits to vaginal steam?
So this is the thing. Asking if there are benefits to vaginal steaming, to me, is kind of like asking a neurologist, is there a benefit to a facial for my migraines? Okay. What I want people to know is that, okay, do you see what I'm saying? It's cute. It's fine. You're putting some steam there. Knock yourself out. You are doing nothing to impact true pathology. Can you potentially get a burn from vaginal steaming? Yes.
Yeah.
Do you know exactly what those herbs are and how they're going to affect you? No. You just don't. And so there's no medical benefit to vaginal steaming. There are a lot of people who are, again, capitalizing on female insecurities in an effort to perpetuate this kind of mindset that I need to be perfectly steamed and lavenderized and whatever to be acceptable to my partner, to be acceptable in society. And none of that's true. None of it's real. None of it's true. If you feel better when you sit over a spot and feel, a pot and feel steam, fine. I'm not going to knock you for it. But there are no medical benefits. A lot of people pay a lot of money and expect results that equal treatment for some sort of disorder or condition that they're just not going to get. So knock yourself out. If you have the money to spend and you want to do vaginal steaming, okay. But if you actually have bacterial vaginosis, yeast infection, cramps, endometriosis, things that actually need medical management and potentially surgical intervention, steaming ain't gonna fix it. It's just
And I'm glad that you're saying that, because that is now one of the most advertised things. De-steaming, and I forget, the many others, but that's the most common advertised thing. It's like, go get it done, do this. And, I want to ensure or make sure that everyone knows, hey, without the medical knowledge behind it, I mean, you either should or shouldn't,
Absolutely. And it's funny because I had someone say, well, doctors say we shouldn't do steaming because they just want to make money. It's like, no. You can steam all day long. I won't lose a patient because it's not going to fix your problem. You're going to end up going to the physicians regardless. You're just going to delay your treatment. And that doesn't hurt. That hurts you. There's no benefit for me. I'm not trying to shut down a steaming spa, but I want people to ask, why do you trust a person who did a 2-day weekend course to learn something about vaginal steaming to fix something about your body that's bothering you significantly, and not someone who trained for 10 years? What about your body and how you value your body suggests that you would rather go to some untrained party than, and I understand there's limitations and hesitations as it relates to medicine and, systemic racism, all of those things, which is why as a Black woman, I'm in the role that I'm in and why I'm trying to educate people like I do. But it's just ask that question. Why do you believe that this young woman in her kitchen came up with the cure of all things and scientists for 200 years didn't? Just think about that. Just be a critical thinker as it relates to your body. I really want you to make good choices about your body. And I want you to be informed about them and feel good about them. But understand that people that look like us, women, they can still manipulate you for financial gain. So I need people to really start to understand that in this world of Instagram, doctors and vagina specialists with no credentials at all, just a vagina. Just a vagina.
I love it. I love it. Man, you said someone. Wow. So there's actually. Go ahead. What'd you say?
I just want what's best. That's it.
Absolutely. Absolutely. And I'm glad you're doing that because, a lot of times doctors do not take the time to explain
Right.
in
Yeah.
detail.
And that's the issue.
Yeah. They don't either they don't have the time because they're seeing patients, or they just just do not have the time to answer questions that, you pay them to see your body, but they can't answer every question that you may have.
You're totally right. And that leads to greater distrust. And that does make you want to turn to someone who seems kinder or gentler or more understanding, even if they don't have that medical background or that evidence-based approach. You're exactly right. So it's a meeting in the middle. Everyone needs, we all need to do better. And part of that is rebuilding that trust and really kind of having these conversations where, medicine and social factors and all of that can be reconciled appropriately, respect both sides.
Absolutely. Absolutely. Well, you've given us quite a bit of knowledge and analogies upon analogies, and I absolutely love it. Thank you so much for your expertise and just, taking the time to answer these questions, but also provide information that, we can either find on Google, which may not, always be 100% correct. It may have added information that's not beneficial, so thank you for what you do, for creating the platform, for, making it to where we're able to go to this one spot and say, hey, she answered this question in this, but daily you post, or not necessarily daily, but the way that you post, you provide information that we just simply do not have to go to Google for because the expert has spoken.
Listen, and that was my hope, honestly. It's something that I don't think I'll tire of doing. And I have loved and genuinely appreciate the support, because sometimes you can feel like you're just posting for nothing. You're like, well, I hope they like it, but when you get that feedback and people are like, wow, that spoke to me, that helps, because that is like an additional after the full clinic day. Okay, what am I going to post kind of thing. But as you said, when it's a passion, it doesn't feel like work. So yeah, I'm blessed and very happy to do what I do.
Absolutely. Well, we thank you for it. Before we end the live, is there anything that you would like to tell our viewers before you head out?
Well, I just want you guys to know, as Miranda mentioned, I love what I do. The Period Doctor is where you can find me on most platforms, especially Instagram at The Period Doctor. You can go to my website, theperiod.com, and kind of look at things there. And I love speaking. If you have, a school or a group of girls or some virtual event or so, those are the things I like to do, when my schedule permits. So feel free to reach out to me, if you ever need me.
Absolutely. And we have all of her information pinned down below. Please be sure to follow her. I follow her on both of my pages. And provides all information that is well needed. Dr. Chambers, thank you so much.
Thank you for having me.
Be sure you stay on the line as I disconnect, okay?